Listen, if you dislike wearing glasses or contacts to correct your vision, there is an alternative. LASIK is the most common type of refractive surgery, and every year, more than 4 million Americans choose to have LASIK surgery. The surgeon you choose can make a difference in the safety and the procedure and quality of results. Finding a surgeon who is experienced and knowledgeable in the LASIK procedure can actually make you feel more comfortable and confident about your decision to choose the procedure. Dr. Dishler has personally performed 51,000 LASIK procedures and was the first surgeon in Colorado to perform LASIK. As seen in Forbes magazine for a second year in a row, Dr. Dishler was voted one of America's top 10 vision correction specialists in a nationwide survey of eye surgeons. Now today, he is joined by another doctor, Dr. Jamie Anderson. She's an optometrist at Ida Eye Care in Highlands Ranch. And Dr. Anderson had been considering LASIK for over 4 years. And when she was ready, she made the right decision. She chose Dr. Dishler. Nice to see you both.
Nice to see you.
So even as an eye professional, it's kind of a big decision to go with LASIK. What were the factors that you had to consider?
You know, I think the best patients to recommend for LASIK either don't like their glasses or don't like their contacts. And I did not have a lot of trouble with my contacts, so I didn't rush into the decision. But finally, I just felt like technology and the right doctor were a part of my life, and I felt like it was time to do it.
And Dr. Anderson, I think it's huge that you chose, and for you, Dr. Dishler, I mean, choosing a doctor that other doctors choose, that says a lot about your credibility and what you do.
Well, thank you. Yeah, I mean, that's, you know, keeping it simple, that's our message today is choose the doctor that doctors choose. We've had dozens of eye doctors come and see us, and they're the ones that really understand eyes and eye surgery better than anyone else. So we're really honored that Jamie picked us for her LASIK procedure.
And why did you choose Dr. Dishler?
You know, it really boils down to technology and confidence in the number of patients that he's seen. He's seen so many patients, he's corrected so many patients' vision, and technology was the key factor that really pushed me over the edge. They invest in their staff and they invest in their lasers, and it's the best in Denver. It's the best in the country. Most
Oh,
likely.
absolutely. I mean, really, they need to log onto your website, do some research, and see the technology that you offer, or actually go to the office. And I'll give you more information on that in just a second. What was your eyesight before, and what is it now?
I was a -4 in one eye and a -5 in the other, which translates to about 2400 vision. So the big E on the eye chart, I could not see without
You were
glasses.
almost blind, right?
Yeah, it was. I had a fairly high prescription, and now I'm 2015 with no trouble. A very, very easy 2015, which is better than 2020.
Yeah, you say 2015, no trouble. How has that affected your lifestyle? I would imagine like with sports and just day-to-day activities too with your family.
Absolutely. Exercising is easier without glasses. Regular sunglasses are much more fun than prescription sunglasses. Yeah, outdoor activities are great. Mornings are easier. Planning a vacation, even a weekend getaway is easier because I don't have to pack any eye gear.
Oh yeah, going to the mountains and lugging all that stuff along. Plus just waking up in the morning.
Absolutely.
I mean, isn't that refreshing where you don't have to like look for your glasses to put on to see what time it is? You can actually see the time.
I still look for them and then I go,
it's
oh,
a habit.
I can see. Yes.
That's funny.
Yes.
Dr. Dishler, many patients are referred to you from other doctors. Tell me what co-management is. How does this work?
Well, co-management's a great situation. Jamie's one of our co-managing doctors, and this allows patients to have both their primary eye care doctor that they know and trust and continue to work with them for their pre- and post-operative care, and then see us for the surgical part of the procedure. And the great part for patients is it doesn't cost them anything more to do that. They get sort of a built-in consulting arrangement. And for patients especially that live far away, and a lot of our patients live much further away than where Jamie's practice is, they can come and see us for their surgery but have the convenience of seeing their own regular doctor while we're always available to them anytime they need us.
So this is huge for potential LASIK patients.
It really is. They get sort of two medical practices for the price of one, really.
So for a potential LASIK patient, then they can see either one of you for care or for LASIK going back and forth. Do I understand that right?
Right. They can see either one. But, you know, our practice is sort of unique in that most of our patients are referred and come from referrals from other doctors, which is partly why we've seen so many doctors as patients as well. And it really works nicely for patients. So we encourage people don't only call us, but ask your local eye doctor who they would recommend for LASIK, and chances are we'll be on their list.
We were just talking about technology. There's some right now that we're seeing at your office. 303-793-3000. You can go to Dishler.com, 303-793-3000. And Dr. Anderson, what would you say to our viewers at home if they're considering LASIK?
I agree with Dr. Dishler. Consulting your primary care eye doctor and then going in for the LASIK consultation. Even if you're not serious or not sure you want to do it, go in for the consultation so you know if you're a candidate. And you know, and go with your gut, go with who you trust, and it's a spectacular surgery.
So again, a potential LASIK patient, Dr. Dishler, they have the choice of either seeing you for all of their care or for the one surgical visit. I know we already talked about that, but I just really want to hit that home.
Sure, it's really up to them. We ask people, do you have a primary doctor? So if people come see us directly, we try to hook them back up and keep their primary eye doctor involved in the process. There are some people that for some reason don't have a doctor and want to see us for everything, and of course there are some people we do that for, but for most people, they like to have that relationship with their primary eye care doctor. So it's either way. It's really the patient, whatever's best for them is what we want, whatever they feel most comfortable with. But so many people have a long relationship with their doctor who understands all the nuances. We can talk to them through the process, and it just gives people that extra thing rather than going to some strange laser center, having something done, and not really knowing exactly who they are so well. And
you must be doing something right because you have patients coming from all over different states also.
Yeah, like, a quarter of our patients come from out of state. We were just talking before the show. Some people say, oh, I live on the west side of Denver. It's kind of far to go, but 25% of our patients come from Wyoming and Nebraska and New Mexico. So we see a lot of people that come from very far away, as well as, of course, a lot from, Colorado. We have a lot from northern Colorado. So we're kind of a regional sort of center for this.
What kind of offer do you have for our viewers today?
Well, we have a good offer, and our offer is that for your viewers, we're offering them a discount, I think $300 off of the normal price that we have. But people have to realize it's very easy for centers to play games with the prices. So our price is guaranteed to be the lowest price for custom all-blade free LASIK to begin with. So ours is truly a real discount from an already very good price for the procedure, but price really shouldn't be people's main concern. Their main concern should be the quality and what they're going to get. And it's not just about getting a good result, but the overall care that they're going to get.
Yeah, outstanding customer service, and pick the doctor that other doctors choose. And Dr. Anderson, let's close on just your experience, the customer service and the relaxation that you had while you were going through.
I have to tell you, his staff and his associate doctors are fantastic. I mean, I was nervous almost more because I knew more of what was going on than the average patient, and they were phenomenal from the minute you walk in the door until you leave. I mean, he's invested not only in technology but in his staff, and it shows.
Excellent. Thank you. And it was nice meeting you.
Nice to meet you too.
Again, see for yourself why Dr. John Dishler was selected 2 years in a row as one of the leading laser surgeons in America. You're definitely going to be in good hands with Dr. Dishler, the Dishler Laser Institute, when it comes to LASIK surgery. LASIK is one of the most successful eye surgeries approved for patients 21 years and older, and hundreds of patients in your age group are having LASIK every day. More than 700,000 LASIK procedures are performed each year. If you're one of the first 25 callers to schedule an all-custom LASIK surgery procedure at Dishler Laser Institute, you're going to save $300 off Dr. Dishler's lowest guaranteed price. And this Colorado and Company special is just for you, our viewers. It's good until October 31st. In addition, if you come in for a free consultation, you're going to receive a free gift if you are indeed a LASIK candidate. 24-month financing is available, so call 303-793-3000 to schedule your free LASIK consultation, or check out their website. Go to Dishler.com. The number again, 303-793-3000 for your free LASIK consultation, and the Dishler Laser Institute paid for this segment.